Hi, my name is Tuva, and in this presentation I'm going to explain what ultrasound and infrasound is and how it applies to medicine. So what is actually ultrasound? Ultrasound is waves with frequencies higher than the upper audible limit of human hearing, while infrasounds are waves with the frequency below the lower limit of audibility. So we are talking about waves, to be specific, mechanical waves, which are sound waves among other things. Mechanical waves is characterized by vibrating or moving particles within a medium. So sound waves are depending on having a medium to pass through. Ultrasound is a pressure wave. These waves also have frequencies, which is a calculation of how many waves pass a fixed point in a given amount of time. The calculations is made in hertz. Humans can hear or detect frequencies from 20 hertz to 20 kilohertz. Babies can actually hear a bit more, but this gets lost over time. Okay, but when we are talking about ultrasound and infrasound, we are actually talking about the sound which our own ear can't hear. Ultrasound is any mechanical wave with a frequency above human audibility limit, while infrasound is the waves with frequencies below. So, how can we use this in medicine? The word ultrasound is a word many people probably have heard before, and we are probably combining it with a pregnant woman or an abdominal check. This is types of diagnostic ultrasounds. Can also call it echography or sonography. This is simply the use of sound waves with a frequency above human hearing to create a picture of, for example, our internal organs. This can help us find the cause of pain, swelling, and infection, among a lot of other things. This is how it works. We need a transducer, which takes electrical energy and turns it into sound waves, or ultrasounds. We often call the wave the transducer sends out a pulse, and the pulse travels through the body and reflects back at any time there is a difference in medium. In this schematic representation, you can see the transducer on the top of the skin on the belly. The orange are supposed to represent the waves the transducer sends out, while the red is the ones who get reflected back. It reflects back when there's an interface between, for example, blood and tissue, or in this case, the baby. The transducer has the ability to time everything, both when the first pulse was sent out and when it came back. Knowing this pulse and knowing the speed of sound, it can calculate the distance of each individual pulse, and by this knowledge create a picture of the baby. As I mentioned earlier, the transducer knows the speed of sound. The speed of sound is the distance traveled per unit of time by a sound wave as it propagates through an elastic medium. It's called propagation or velocity. The speed of sound is related to the density of the tissue, propagation of that sound through the tissue, and the speed of sound itself. Then we have the acoustic impedance. It explains how much resonance an ultrasound encounters as it passes through a tissue. This is measured in megaarrays. We use to determine if the sound gets reflected or transmitted. Because every wave of sound will not just get reflected, some things can also get transmitted or pass through the tissue. We want a reflection in order to get the best image. The bigger the difference in acoustic impedance, the more sound is reflected. If two materials have the same acoustic impedance, they are called acoustically matched and all the sound waves is transmitted. We can, for example, calculate acoustic impedance if we know the density and the speed of ultrasound in the specific tissue. In order to calculate whether or not the ultrasound will get transmitted or reflected, we can use the intensity reflection coefficient for any boundary between two media is given by this formula on the bottom, where acoustic impedance 1 and 2 are the acoustic impedance of the two medias making up the boundary. Now we can kind of understand why we use or always see a gel when, for example, you're getting a pregnancy checked out. In order to create the best image, we have to put a transducer with a minimal amount of air in between the transducer and the skin, because air has a low acoustic impedance and will therefore reflect the sound back. In order to prevent this, we use a gel that has a similar acoustic impedance as skin. Now we know that not every sound wave gets reflected back to the transducer because some things get transmitted. But we also have scattering. That is when the reflection happens, but it is not reflected back to the transducer, and the information is lost. Absorption, on the other hand, is when the sound is transformed into heat and absorbed by the tissue. There exist 4 different modes of ultrasound which are used in medical imaging. A mode is the simplest type. B mode is the most used type. And you have, for example, the Doppler effect. This mode makes us use the Doppler effect in measuring and visualizing blood flow. Doppler sonography has an important role in medicine. It uses the Doppler effect to assess whether structures are moving away or towards the probe. We also have infrasounds. As I mentioned, infrasounds is the waves with frequency lower than what we are able to hear. This is used in, for example, monitoring of earthquakes and volcanoes, but it's also used in medicine. An example is the ballistocardiograph. It is a non-invasive method based on the measurements of the body motion generated by the injection of the blood at each cardiac cycle. It is one of the many methods relying on the detection of cardiac and cardiovascular related mechanical motions. And this is my sources. Thanks for watching.